Hi, this is Dr. David Wade. Now, is that one on over there too?
It should be, this is sure. Oop, I forgot to hit record. Alright, go ahead, Dr. Wade.
Hi, this is Dr. David Wade. I'm coming to you live from Anniston Chiropractic at 3001 McClellan Boulevard in Anniston, Alabama. We took over what used to be the Burgess Chiropractic office, bought the building a few years ago, and we've been up here practicing, going strong. Went through the COVID, now we're here back, everything's nearly back to normal, but I wanted to talk to you a little bit about some of the benefits of chiropractic care. This is something that's very close to me. It's the spine. And so when you're looking at the spine, there are the bumpy parts that you feel that would be on your back, and then you have the body of the vertebra up here in the front, and then you have the spinal cord that comes through this opening of, it's encased in solid bone, and then you have these little sideways pieces that are called the transverse process, and then basically you have the disc. Now the disc is sort of like a jelly donut shape with a nucleus in the middle. You have these annular bands of crisscrossing fibers that are kind of like, remind me of the fibers of a ski rope. And so if you had a disc, which kind of fibers would you rather have? Something solid like this or something frayed and open like this? So if you had a healthy disc and you have these fibers that surround the jelly like this and you have pressure coming down, if you think about a water balloon, if you pushed pressure down onto a water balloon and I applied pressure down onto the balloon's going to spread out. Well, that allows the fibers to tighten up as it spreads and protects and keeps the jelly in position. Well, sometimes what happens is the jelly gets shifted. Well, that only occurs because of some type of overloading stress to the fibers, the ligamentous structure of the disc. And so what ultimately occurs as a result of that is the jelly begins to kind of tear out through the opening of the fibers. So if the fibers of the disc are more frayed like this, where they've been stressed for a period of time, or they become damaged, there's nothing now to retain the jelly in its position, so it begins to slip and create problems. Now, all of the problems that we see in our office are really related to something that we call a subluxation. Now, a subluxation is a mechanical fault that creates pressure on the spine and the nerves, and it disrupts the signal from your brain to your body. Always a subluxation is caused by some type of stress overload. So there's a couple of different types of stress overloads that we see. Have you ever heard that stress actually does cause health problems? Most people would agree that it does. So like what? What kind of problems does stress create? When I ask this in lecture format, and I have an audience out there giving me feedback, they'll say, well, stress can cause ulcers. And I'll say, yeah, good. What else? They say high blood pressure. And I'm like, yeah, that's exactly right. What else can stress cause? It can cause reflux and digestive problems. Yeah? It can make you fatigued and irritable and not sleep very well. That's exactly right. It can cause headaches. That's true. Stress can cause all these things. And then neck and back pain can tense up because of stress overloads. Well, when I say stress, most people think in terms of the emotional things of life that are stressful that we all deal with. All of these things like that can be potentially stressful or problems with a relationship, children who get in trouble, the death of a spouse or a child, having to move, change jobs. All of these things are extremely stressful and can create tension, pressure. So when stress occurs, normally the body and the brain are supposed to handle and adapt to the stress, but when it overloads, the body becomes distorted. So one of the things that happens with that is that the daily stresses can be accumulative or significant in trauma, and if it's not addressed, then the damage will be developed and cause problems. So the stress can cause the physical damage, which is ultimately the subluxation that creates the problems inside your body and can potentially lead to serious diseases. Now, I usually like to talk in terms of how that affects function. So when you have a subluxation and you're disrupting the signals from your brain to your body, can you see how that begins to have a negative effect on function? A lot of times people think that as soon as the function starts to drop, that you begin to have pain immediately. Well, that's not necessarily the case. A subluxation can develop insidiously, just like heart disease or cancer can, and it develops slowly and horrendously worsening over time. So we consider a subluxation to be a bad problem. So when pressure builds up tension in the muscles and the muscle develops the distortion and the stiffness and the structure develops, that's really what a subluxation is. And when you have that misalignment with the loss of function, the subluxation is now manifesting. So there are multiple components that we look at and we address and we evaluate. One of the first ones that we look at in the office is our posture. So with posture, and a stress adaptative posture is frequently what we call a forward head posture. The head begins to droop forward, the body begins to react to the stress, and that begins to create distortion and muscle imbalances. Well, as the function drops from, let's say this is 100% up here, and it goes to 90, and then to 80, and then to 70, and then to 60, that's kind of like a pass-fail line. So if you got a 60 and down below it is a 50, that's an F, right? So when you go on down lower, the question is, okay, how far down do you have to go before you feel the first symptom? Most people, when I ask that question to my patients in the office, they'll say, well, I guess when the function gets down to about 80%. And I'm like, no, not really. And the reason is because only 10% of the nerves in the body even carry pain signals. Most of the time you don't realize that pain is part of the learning process, and only about 10% of the nerves in the brain are used for learning. Most of the nerves are relative to autonomic function and automatic things that goes on, digestion, assimilation of food, heartbeat, rhythm, liver function. There's over 1,000 different enzymatic functions of the liver. Well, all of these things happen and begin to go bad as the body begins to develop the stress. So you've got to get your function level way on down. So it's not 100, it's not 90, it's not 80 when you first feel it. It's not even 60, it's not even 50. Because you could give a kidney up to a family member and live perfectly fine with no symptoms whatsoever, working on 50% of the function of your kidney combination.
Wow.
So you have to end up getting on down below that. 40, you begin to feel tired and run down. 30 is usually around the threshold level where people begin to feel function. All right, let me ask you this as a question. Do you know how much blockage in the heart you have to have before they are willing to do a stent or unblock the damage?
I have no idea.
Okay, it has to be 80% blocked. That's the benchmark. So when your heart is 80% blocked, that's when they'll open it up and do a stent and tell you that you need, you had a STEMI, or they'll do a stent, or sometimes a complete bypass. Normally the bypass is not done unless there's a complete blockage in multiple levels, and then they're pulling veins out of your leg and reproducing the veins to open up the flow. The heart rate's important, and the heartbeat's important, and the heart's important. And if you don't have the blood to the heart's going to die. So that's a problem. So that's why they want to reestablish it. Well, if you could think in terms of the body relative to the nerve circulation to the body, it's important. So as it begins to choke down, my question is, when do you start dealing with the problem? Same thing with the heart. Do you wait for a heart attack to start eating better and exercising? Some people do. Is it the best logical way to approach it? My answer is probably not. So if you want to be more proactive, you need to understand the importance of how do you address these problems before they become so critical. We have a young lady that walked in this evening, walking twisted, sideways. Younger woman, a little bit of stress in her life, a few different health issues that she's had, but the bottom line is, 28 and can't do her job. She wasn't able to go to work today. It's very frustrating when you're hurt and you can't even stand up straight. So my question is, do you wait for the crisis, or do you do something more proactive? Most people in our society are focused, because of the way the drug commercials work and the pharmaceutical industry is involved with people's lives, that the majority of medical intervention is way down at the end of the spectrum. You've got to be below 30%, usually around 20% function before medicine even has intervention criteria that's met to be able to provide you with any kind of treatment. you gotta understand that symptoms are warning signs that there's a problem. You can have ongoing reoccurring problems. This poor girl had radiating symptoms and tingling and numbness in her legs for months, but her back didn't go out until just like, a couple of days ago. Got so bad this morning she couldn't go to work. So now she's coming to my office to get some help. And we've just looking in the process of evaluation, and I'm thankful that we're gonna be able to help her. Now, we look at the structure of the body as an important component of the support and the protection of the nervous system. Chiropractors, most people think of chiropractors as back doctors. The reality is we're probably more closely related to nerve doctors. We look at the nervous system as the power that supplies the energy and vitality to the body that keeps the body working and functioning and productive.
Sorry to interrupt. Brittany Way tried to call you.
Okay. So one of the considerations that we have here is that we know that when the problem begins to develop, that you'll develop localized inflammation, heat, redness, swelling, pain, loss of function, and in the muscles as they begin to build up tension, they can develop adhesions, they can develop scar tissue, they can develop fibrosis. When you have fibrosis in the muscle, which is a medical term for muscles, myo, and you can develop the fibro in the myo that creates the pain, which is the algia. You can end up combining those words and say fibromyalgia is sort of the progression of a muscle that's been chronically tight and imbalanced. That's a serious mechanical, neurological compromise to the integrity of function, and many doctors don't really know how to treat that other than through medication. Usually it affects serotonin levels in the brain, and they're not sleeping well, so you end up with antidepressants and different types of problems associated with that.
I have an idea. If you want to continue this, let me try to bring on the TikTok side real quick while we're still going here. No one even popped up on YouTube yet. So you okay with that?
Yeah.
Okay. Give me 1 sec. I'll go live on TikTok.
Should I answer my daughter?
Yeah. Take a minute and go and give her a call back. I'll go ahead and end it here.
All right.